Good morning, one and all. Myself, Dr. Rupashree, consultant obstetrician and gynecologist, Star Hospital, Hyderabad. Today, the topic of discussion is previously we have discussed regarding the amniotic fluid, its formation, production, absorption. Okay, what are its consequences? Everything we have seen. Now, in this class, we'll see regarding the polyhydramnios. Okay, what is this polyhydramnios? See, in the name only, poly means we'll say many or much amount. Okay, increased amount. Hydramnios means, as I said, it is the liquor amni. Okay, so increased amount of fluid is the polyhydramnios. Okay, we'll start the session now. Now see, what is this? As I have said, it is a clear yellowish fluid surrounding the baby. Okay, it is present surrounding the baby and protecting the baby. So now see, what we'll see. Its definition is, it is divided into of two types. It is of both. We'll go regarding the first one, anatomical definition. That is, if the amniotic fluid is more than 2 liters or 2000 ml. So anatomical means we are going structurally, we are seeing it. So it is more than 2 liters or 2000 ml. Now we'll see clinically. Clinically, how we'll define it means, how first of all, how we will measure it. Okay, how we will measure it with the help of an sonographic machine, ultrasound, right? So we'll see. It is defined as, if the amniotic fluid index is more than 24 centimeters. Okay, see, as I have said initially, we'll define the abdomen into 4 quadrants. Okay, we'll measure the amount of amniotic fluid in each quadrant and we'll add it. The final amount of result we will be saying to the patient. So, if the amniotic fluid index is more than 24 centimeters, or if the amniotic fluid index is greater than 95 centile for the gestational age, 95 centile for the gestational age, or other thing is, if even in a single vertical pocket, see, if we, for example, if we are measuring only in this quadrant, okay, if we are measuring only in this quadrant, and if the single pocket, see, for example here, the single pocket is greater than 8 centimeters, okay, greater than 8 centimeters, it is defined as polyhydramnios. So there are two definitions. One is the anatomical definition, that is more than 2 liters, and clinical definition is, that is amniotic fluid more than 24 centimeters or greater than 95 centile for gestational age, or if the single vertical pocket is greater than 8 centimeters. Okay, right? Next, see, we'll see the incidence. See the baby here and the excess amount of amniotic fluid. Okay, we'll see. So incidence, it is almost only 1 to 2% only. Okay, very less. If there are any 100 pregnancies, there 1 or 2 will be the amniotic fluid, increased amount of amniotic fluid. And we commonly see this in the multipara condition. Multipara condition. Why? We will see regarding it. And the third point is, if we see clinically, almost in 100 pregnancies, or we'll see 1000 pregnancies, only one pregnancy with amniotic fluid, increased amniotic fluid or the polyhydramnios, will be showing signs and symptoms. Okay, so incidence, it is only 1 to 2%, and we commonly see it in the multipara, and the symptoms which are produced by the polyhydramnios are seen only in 1 in 1000 pregnancies. Okay, this is the incidence. Now we see regarding the etiology. Regarding the etiology, as I said in the previous classes only, first point is, there is increased amount of amniotic fluid production. Increased amount of amniotic fluid production. And the second is decreased absorption of the amniotic fluid. Okay, again, see, the fluid will be swallowing it, the baby will be swallowing the fluid, again the baby will be urinating, some amount of fluid will be coming from the placenta, maternal membranes, and the urine will, like that we have studied in the previous classes. So there is increased amount of amniotic fluid and there is decreased absorption of the amniotic fluid. Now we'll come to the exact etiology. What are the conditions which are leading to this increased amount and decreased absorption? Okay, first one, mostly fetal anomalies, congenital anomalies. These result about in 50% of the cases. Okay, that is first one is anencephaly. We have already studied regarding this. See, anencephaly means there is no formation of the skull or the cranium of the baby. There is no skull or the cranium. See, actually, see how the baby's head is covered here. This is the skull, right? Now, there is no cranium or the skull here. So, what happens is, what is the reason? First one, there is increased amount of transduction of fluid from the membranes. Okay, so there is no covering here, there is no cranium, there is no skull. What happens? The amount of fluid which is present in this comes out. So transduation means fluid which is coming out through membranes or pores. This is known as transduation. So the excess amount of fluid coming outside. Okay, second one, decreased fetal swallowing. Decreased fetal swallowing of the fluid, and the third is decreased amount of antidiuretic hormone. See, there is no proper brain formation here. There is no cranium, no skull, no proper formation of the intracranial structures. So what happens? The amount of hormone, that is the antidiuretic hormone, is decreased here. So what happens? It results in increased urination of the baby. Okay, there is increased urination of the baby. So these are the three conditions, right? Okay, these are the three conditions. So transduction of membranes across the transduction of fluid across the membranes, decreased fetal swallowing, and increased amount of urination because of the less amount of hormone production. Next, second is SEER, esophageal atresia. What happens is, here the baby should follow the fluid, but what happens because of this esophageal atresia or duodenal atresia? Second point, esophageal atresia or duodenal atresia. Okay, so this is a second condition. There is no swallowing there, so it results in excess amount of accumulation of fluid. Third one, see, hydrops fetalis. Third is Hydrops fetalis, this is seen in RH isoimmunization, right? RH isoimmunization. So what happens? Here there are cardiothoracic abnormalities, okay, and fetal cirrhosis. So these conditions lead to excess amount of fluid accumulation in the uterus. And next condition is the cleft lip of the baby. See, cleft lip and the cleft palate condition. What happens? This interferes with swallowing of the baby. There is no swallowing of fluid by the fetus. So it interferes with the swallowing of the fluid by the fetus. Okay. So these are the conditions. As we say once again, see, first one is anencephaly. Next is the esophageal or duodenal atresia, and other one is the hydrops fetalis, and the next is the cleft lip or the cleft palate. Okay, and aneuploidy conditions also may result. Aneuploidy means chromosomal abnormalities. Okay, which leads to like Down syndrome and Edward syndrome. Okay, aneuploidy conditions also. Next. So the next is the after fetus, next is the maternal thing. So what happens is, if the mother is diabetic, okay, that may be gestational diabetes, okay, that may be type 2 condition. What happens is, if mother is diabetic, there is raised maternal blood sugar levels, okay, blood sugar levels. What happens? This lead to raised fetal blood sugars also. Okay, if increased amount of fetal blood sugars are there, what happens? It leads to increased fetal urination of the baby. Increased fetal urination, and this lead to polyhydramnias. If we correct the maternal blood sugar levels, this condition can be terminated. Okay. So what happens is, in diabetic, there is increased maternal blood sugar levels, increased fetal blood sugar levels that lead to excess amount of fetal urine production, and then the polyhydramnios. And the next is sometime if the mother is having any renal or cardiac conditions, what happens? It lead to edema of the placenta. If mother is having any other diseases like renal conditions or any cardiac conditions, edema of the placenta. This lead to excess amount of fluid accumulation because of the transduction mechanism. What I said, the fluid from the membranes or pores will be accumulating outside. So if there is any edema of the placenta, the amount of fluid which is present in the placenta also enters into the amniotic fluid. Okay, only two conditions in mother: diabetes, renal or cardiac conditions. Okay. Next, multiple pregnancy. Okay, this is seen mostly in the monozygotic twins. Okay, monozygotic condition, that is twin transfusion syndrome. I think most of them are familiar with this condition in which there are two fetus. Okay, see one baby. This is a one baby and this is a second baby. See, the recipient twin, the one which is receiving, receives everything. So what happens? Excess amount of fluid gets accumulated in this sac. Okay, so this is the condition of oligo and this is the condition of poly. So if we take this as first sac and this is second sac is of recipient twin, okay, and excess amount of fluid is accumulated, it leading to the polyhydramnios. So monozygotic twins. Next is the placental condition. This is chorioangioma of placenta. Chorioangioma of placenta. It is a tumor of the placenta, very rare condition. Okay, what happens in this? It is a tumor in the placenta. It grows from a single villus. Okay, single villus. It leads to the, what happens? It leads to the hyperemia or hyperplasia of the maternal or placental blood vessels. Hyperplasia of the placental blood vessels. Okay, excess amount will be accumulated. With this, it leads to the excess amount of fluid to get accumulated. Okay, so hyperemia or hyperplasia of the blood vessels and the connective tissue of the placenta. Therefore, because so only one phenomenon, that is transduction, that is the fluid which is accumulated inside comes outside and gets settles in the amniotic fluid. So placental condition is chorioangioma of placenta. Okay, there is anatomical definition, clinical definition. Okay, incidence is only 1 to 2%. Mostly there are fetal conditions like anencephaly, fetal cirrhosis, cleft lip, cleft palate, and duodenal atresia, and mother conditions like diabetes. Okay, for other multiple pregnancies, and next in the placenta there is the chorioangioma of the placenta. Okay, I think these etiologies are clear to you all, and next meet us in the next topic. Okay, thank you.